everyone, I'm Tara, the occupational therapist here at our Tinton Falls location. And today we have patient Dylan, who we will be going through some shoulder cupping exercises with him. And we're going to be talking about the uses of cupping for patients who do a lot of overhead motions. And today we're going to be just breaking down some exercises and the benefits of doing them in office. So Dylan is a parkour athlete as well as an instructor, and he comes in with a lot of chronic shoulder pain, tension, and instability. And so today we're going to be putting the cups on, and I'm going to just show you how we typically put them on for somebody who is an overhead athlete and just the common areas that seem to be very tight. First is typically the upper trap area. Especially if you have some pain that's radiating into the neck. This is a really important spot to have a cup. Next for him is going to be some posterior shoulder. He has a lot of tension in his scapular area back here. And then following that would also be his lat area, which is going to be down in here. Dylan, I'm going to have you just move your arm up a little bit. Perfect. Okay. The other area that I typically put cups on for an overhead athlete would be in the scapular area back here, in between the spine of the scap and the vertebrae back here. And our last spot for shoulder cupping would be in the front of the anterior part of the shoulder, which is going to be a little bit of the pec area and the rest of the rotator cuff. So now we're going to have Dylan do a wall mobility exercise for his shoulder. We call these wall slides. So Dylan's going to go ahead and put his arms onto the wall. We're going to have him slide his hands up the wall to get a really good stretch for that right shoulder that's been really tight, especially in that lat rhomboid area. So for this exercise, he's going to do a couple repetitions, but this exercise helps stretch out the shoulder, put him in a good postural position, work on those postural muscles. You can see him going into a little bit of a scap retraction, which promotes good upright posture. And this is overall just feels like a really good stretch, especially for somebody who, again, is an overhead athlete, does a lot of pushing, pulling, and anything that aggravates the shoulder girdle. The next exercise that I'm going to have Dylan demonstrate is our wall push-up. So Dylan's going to go up against to the wall and put his hands on the wall, take a little baby step back, and he's going to go and do some into push-up position up against the wall. And this exercise is geared towards more of the stability strength training for the shoulder. In comparison to our last exercise, that was more about stretching and decreasing some of the tension in his muscles. So for this exercise, we're really focusing on improving his posture with the movement of his scapula. And as you can see, when he goes down into push-up position, you see a nice, good squeeze of those shoulder blades together. And this is really important for improving posture, especially because every time somebody comes in with a shoulder injury or shoulder pain, posture is always going to be a very important thing to focus treatment on. The last exercise we're going to have Dylan demonstrate is planking with the cupping on. So Dylan is going to go into a plank position and hold that. This is probably one of the closest exercises that's functional for what he does with parkour, holding all sorts of planking positions, again, with pushing up into different positions. This is probably the closest we'll get to mimicking some of the stuff that he does in his everyday life. While he's in plank position, the cups are there to help increase circulation and improve his shoulder mobility, as well as give him a little support while doing this to help alleviate some of the pain when in plank position. So Dylan typically would do a couple sets of these and hold it for probably about 30 seconds. And again, this is going to help strengthen that shoulder girdle and improve that posture, which again is always very crucial when it comes to shoulder instability and pain. So after cupping, Dylan should expect to feel a lot looser, have a lot more range of motion in his shoulder, and feel really great leaving here by increasing a lot of that circulation and improving that mobility. The postural stuff that we've been working on is definitely going to help improve, again, that shoulder mobility and strength, and hopefully get him back to doing all of the things that he loves to do. So I just wanted to take a moment and say thank you, Dylan, for demonstrating all of our exercises today. And to our viewers out there, if anybody has some shoulder pain and instability, think about coming on in and we'll help you with that.